Good morning friends. Today we will discuss about diabetes pharmacology. So, diabetes. The basic treatment for diabetes starts with insulin therapy. In case of type 1 diabetes mellitus, insulin is a hormone released from pancreatic beta cell and it is bound with zinc molecule. Average daily secretion of insulin is about 30 to 40 units, which is approximately 25% of total pancreatic insulin content. Insulin was released when plasma glucose increases. So this was the main reason for release of insulin. So this was a structural representation of insulin molecule. Insulin molecule was divided into three types of component. A chain, that is acidic chain, consists of 21 amino acid. B chain, that is basic chain, which contain 30 amino acids, and the yellow colored ball arranged in a series are called C peptide, which contain 31 amino acids. So proinsulin, which is composed of all the three types of chain. When C peptide separates, then it gives insulin molecule. Proinsulin, having molecular weight is 9000, whereas insulin molecule possess 6000. In blood or in plasma, proinsulin, insulin and C peptide are present. 30% of plasma insulin is obtained from proinsulin. So, sometime doctor may suggest that identification of C peptide rather than insulin means C peptide gives exact value to that of insulin molecule, and these A chain and B chain are linked by disulfide linkage. Factors which affect release of insulin. So there are certain release stimulator and release inhibitor. So which component stimulate insulin release and which are responsible for suppression of insulin release, we discuss in this slide. As you are aware, glucose stimulate insulin secretion, glucagon. Then anti-diabetic drugs like sulfonylurea stimulate insulin release. That's why they are called insulin secretagogue. Then leucine, ACTH, corticosteroids and vagal stimulation increase stimulation of insulin molecule from pancreatic beta cell, whereas other side of this table gives certain components that suppress insulin release or inhibitors, that are catecholamines, external administration of insulin, starvation, then phenytoin, potassium deficiency and vagotomy that suppress insulin release. Glutathione insulin transhydrogenase, it is an enzyme which metabolizes insulin in liver and kidney by break down the disulfide linkage and separate two chains. So in this case we discuss about pharmacology of insulin. What are the pharmacological effects produced by insulin molecule? The first action is on carbohydrate metabolism. It increases glycogen synthesis, that is glycogenesis, and inhibit glycogenolysis and gluconeogenesis process. On fat metabolism, insulin deficiency leads to breakdown of fat molecules for production of energy. So because of that, triglyceride and free fatty acid level increases in blood. An increase in free fatty acid increase ketone body formation, and that further increase a load on kidney. Further, insulin used in protein metabolism cases where deficiency of insulin cause impairment in protein synthesis, and due to which muscle wasting condition may develop. So insulin considered as anabolic steroid, or it possesses anabolic effect. Insulin also helps in the electrolyte and water balance. Increased breakdown of protein and glycogenolysis and tissue hypoxia leads to escape of potassium from cell to extracellular fluid towards urine. So that can be suppressed by insulin administration. Along with that, insulin helps in the water balance. Increase in osmotic pressure cause increase in urine. That increased urine gives rise to dehydration cases. So insulin reduce the symptom like polydipsia by altering the condition. So these are the some insulin actions where it act on membrane. Insulin increase glucose transport, along with that amino acid, fatty acid and certain ion transport increases via membrane. Whereas insulin on intracellular, it increase RNA and DNA synthesis, glycogen synthesis, then protein synthesis. Along with that, it stimulate glucokinase enzyme and inhibit glucose 6 phosphatase enzyme. Whereas insulin increase lipogenesis and decrease lipolysis process. So these are the actions of insulin on cell membrane and intracellular component. So we will discuss about mechanism of action of insulin. So this was structure of cell membrane. It is composed of insulin receptor. That insulin receptor is a combined unit, possess alpha and beta subunit. When plasma glucose increases, pancreas sense that increase in plasma glucose, pancreas releases insulin molecule. So insulin molecule act on insulin receptor. After binding of insulin molecule to its receptor, that is tyrosine kinase type of receptor, the tyrosine kinase activation takes place. Because of tyrosine kinase activation, insulin receptor substrate activates, that gives rise to growth, differentiation and survival. Along with that, glycogen synthesis, fatty acid synthesis and protein synthesis takes place. Further, insulin mediated action via PI3 signaling and insulin signaling pathway along with MAP kinase activity. Via insulin signaling pathway and PI3 signaling, insulin after binding to receptor cause conformational changes and mobilization of blood 4 vesicles from cytoplasm towards the cell membrane. So this was the mobilization process of blood 4 vesicles from cytoplasm to the cell membrane. So after mobilization of blood 4 channel activates An activated platform responsible for entry of glucose molecule from plasma to the cell inside the cell, and that reduce glucose. Further, insulin signaling pathway stimulate lipid metabolism responsible for growth and protein metabolism, whereas MAP kinase responsible for gene expression. So this was the overall mechanism of action of insulin. So these are the certain abbreviations used in previous mechanism. So this was the action of insulin. Firstly, insulin increased cyclic nucleotide phosphodiesterase. So that was the enzyme responsible for destruction of cyclic AMP. So cyclic AMP responsible for glycogen breakdown. So ultimately insulin causes synthesis of glycogen, means by destruction of cyclic AMP, insulin stimulate glycogen synthesis in liver and skeletal muscle. Further, insulin facilitate potassium transport in cell. These potassium molecule along with magnesium helps in various enzymatic reactions. So insulin deficiency. This table gives idea about insulin deficiency and during that process which are the biochemical reaction takes place. Increase in glycogenolysis in liver. Because of increase in glycogenolysis, increase glucose. Because of that, increase osmotic pressure and dehydration takes place. Secondly, increase in gluconeogenesis. So, increase in glucose production from non-carbohydrate moiety is called gluconeogenesis. Because of insulin deficiency, protein and lipid breakdown takes place in muscle and adipose tissue that cause production of amino acid, glycerol and fatty acids. Then because of these molecules, amino acid and glycerol, increase in glycogenolysis process and gluconeogenesis, whereas increase in amino acid, glycerol, fatty acid increase ketogenesis process. So ketoacidosis may develop. So this was a main process determining blood glucose concentration. So blood glucose can be reduced by acting on certain sites. So insulin act on different sites. Some are having positive sign, some are having negative sign. On negative sign, insulin decrease glycogenolysis in muscle and liver, and in liver it suppress gluconeogenesis, whereas in glucose and glucose production was suppressed from liver, and uptake of glucose in skeletal muscle is increased by insulin molecule. So these are the certain types of insulin available in a market. Some are rapid acting, some are short acting, some are intermediate acting, and some are having long action. So based upon different types of insulin, physician determine the dosage and type of insulin that suits to the patient. So this was certain insulin product with their onset and duration based upon rapid action, intermediate and slow acting insulin molecules. So based upon that, what are the uses of insulin? So insulin first and foremost used in the treatment of diabetes mellitus. Along with diabetes, it can be used in the management of schizophrenia, where insulin shock therapy was used, in treatment of myocardial infarction. In combination with glucose and potassium chloride, insulin was used. Also, in the treatment of anorexia, that is, insulin increase appetite and body weight. And in case of burn condition, where insulin with glucose molecule reduce potassium loss in burn cases. So this was a uses of insulin. As it possesses lot of uses, means it is having certain adverse effect, that are, as it cause hypoglycemia, it has to be administered parenterally, so local itching may develop. Insulin given repeatedly on a same site or same location, it produces lipoatrophy. Sometimes insulin cause presbyopia, that is loss of accommodation. Insulin may precipitate pre-existing neuropathy. Insulin resistance may develop as daily requirement of insulin increases. So insulin resistance type of condition may develop in chronic phases. And if insulin was administered to a patient, we have to restrict the diet. So without restriction, obesity like condition may develop. Next hormone from pancreatic beta cell is glucagon. Glucagon helps to increase glucose level. It is totally opposite to that of insulin molecule. So increase in plasma glucose stimulate insulin release, whereas decrease in plasma glucose stimulate glucagon release. So glucagon was released in fasting or starvation condition. So use is in insulin hypoglycemia or hypoglycemic coma, that can be given with dextrose molecule. Also, glucagon used as a diagnostic agent for identification of insulinoma and pheochromocytoma. Next hormone from pancreatic beta cell is somatostatin. Somatostatin, it is a hormone that regulate release and inhibition of insulin and glucagon from pancreas. So these are some actions of somatostatin. Some are endocrine action and some are non-endocrine action of somatostatins. So two conditions develop. One is diabetic coma, another is hypoglycemic coma. In both cases, patient may feel drowsiness and sometimes it fell down because of alteration in sugar level. In diabetic coma, that can be precipitated due to insulin deficiency. Diabetic coma increase fatty acid metabolism, and because of that ketoacidosis may develop. Hyperglycemia and glycosuria result into dehydration and hypovolemia in case of diabetic coma. In diabetic coma, the plasma glucose may reach up to 600 to 800 mg per dl, and insulin is only the treatment for diabetic coma. Whereas hypoglycemic coma develops due to mismeal, extra exercise or violent exercise, and sometimes overdose of insulin. In this case, cerebral glucose deficiency takes place. Because of decrease in cerebral glucose, confusion, depression, convulsions, visual disturbances may develop. In that, sympathetic activation leads to vasoconstriction, tachycardia, palpitation, sweating. And for treatment of hypoglycemic coma, only glucose administered is beneficial. Sometimes glucose along with glucagon can be administered to relieve symptoms associated with hypoglycemic coma.